Hello, all the participants. Very good afternoon, ladies and gentlemen. Thanks a
Afternoon.
million for the opportunity to talk about cognitive behavior therapy dealing psychological issues. My heartfelt gratitude to chairperson Dr. Chelvi and organizing secretaries Dr. Poonam Sharma and Mr. Navina and Amity University for giving me this, inviting me to present a webinar today. As you know that they have given me a lot of introduction about, my name is Koparan Devi Gurusamy. I'm working as a clinical nurse specialist in Dublin, North City Mental Health Services in Dublin. I've been in this psychosocial intervention specialized for a couple of years now, more than 15 years with the patient as well. So I can share my experiences with you. Psychological issues. I'm not going to mention about the major mental health disorders or mental illnesses. Okay, if you don't deal with this minor psychological issues, it may lead to the major mental health illnesses. So the sleep problems, mood changes, chronic pain and multiple medical issues, and alcohol and drug misuse, and phobias and panic attacks, which we encounter every day, like and excessive anger and low self-esteem, obsessive thoughts, and social isolation. If we don't deal with the psychological issues, minor psychological issues, then it'll be kind of getting into a kind of moderate and then the major mental illness. Okay. And then what is CBT? So it's a definition that cognitive behavior therapy is a school of psychotherapy that aims to help people to overcome their emotional problems. What is cognitive? Cognitive means it's a mental process like thinking, what we think, okay? And the behavior refers to everything you do, action and inaction. Sometimes you're stunned and you don't do any action at all. And therapy is a systematic approach to combating a problem, illness, or irregular condition. Okay. Before going into the cognitive behavior therapy, how am I going to have a therapy towards any people or learning the skill from cognitive behavior therapy? We'll have to do the assessment. Okay. The assessment is important. How we are going to assess psychologically, it's the stress vulnerability model and how we are reacting to stress. Okay. And if you have a stressors, something a very stressful triggers coming in, and that if you have that, you are less vulnerable, you are not having a biological problems, or you're not having psychological problems, you are not having any psychosocial stressors from outside, means you are healthy, you have a good threshold to have a resilience to cope with it. Okay, that way the continuum will be a healthy one. Okay, somebody really more vulnerable. So biologically they are vulnerable, psychologically they are vulnerable, and socially they are vulnerable. Some social family problem. So that means you get into that lower threshold and then you will become illness. Okay, this is the way we assess any people, that where do they fall under it, whether it's a mild, moderate, or a severe kind of stress they are. Okay, and how they are vulnerable to it. Okay, that's what we'll assess usually in any situation that. Okay, and after assessing it, how CBT works, you'll have to analyze that how it's going to work for me. Okay, each session lasts between 30 to 60 minutes. Okay, you can have CBT on its own or combine it with medication if it is needed. If you have a severe mental illness, you need to take a medication therapy along with cognitive behavior therapy. Okay, if you don't have any kind of severe illnesses, just a minor psychological issues, I have only sleep problems, you can have a sleep hygiene techniques and having a bit of CBT with it. Okay. And CBT involves written work. You have to have a diary and you have to commit yourself to do the homework. It's a worksheet, lot of worksheet and homework you have to do it. It's time limited between 6 to 20 sessions. Like if it is mild, you may need 6 to 8 sessions. If it is moderate, up to 14 sessions you need it. If it is really profound and severe, you may need longer sessions. That is what. And CBT is not just a chat, okay, talking about that, what did you do? And like a friendly chat, which you can do with your close friends. It's not a chat. It is a talking therapy. There is a structured way you are going to express your feelings and also having a problem identifying and resolving it. Okay, that is what it is. CBT. What is CBT? It is more about the therapy requires a sound therapeutic alliance. What is therapeutic alliance? Therapeutic alliance is the participation between the therapist and the client. That's very important. Therapist has the knowledge, expert, and knows everything detail about what's going on. What the patient, that is the client is here to learn about that. But client is the very important person here. And the power of knowledge shouldn't influence the client. That is what is very important. So the sound therapeutic alliance, the therapist is really kind of facilitating the session for the client. Okay, here is more about client oriented, client focused. Okay, they want to learn and they want to improve themselves to the skills. Okay? It emphasizes collaboration and active participation. That is what is very important. The therapist have to give the chance to participate for the client to learn a lot as well and to express their feelings and emotions as well. It is based on an ever-evolving formulation of the client and their problems in cognitive terms. That is what it's about. I'm going to explain to you thinking, feeling, and acting. Okay, that is what the formulation you're going to make in a cognitive terms. Okay. The therapy initially emphasizes the present. What is the present problems you are facing it? Why did you come for the therapy? That is what we are going to focus on it. That's what therapy as well speaks in it. The therapy is educative, aims to teach the client to build that they are their own therapist. Okay, that's what is important. It emphasizes the relapse prevention for the individual, for the client. How am I going to prevent the relapse or any difficult situation comes it? How am I going to deal with the problems? Okay, that's what is in the therapy a lot. And the therapy sessions are structured. It's a time, you have a set time for it, it's a structured, and there is no kind of informal chat or anything. It's always a kind of goal-oriented and problem-focused. It's a task. We are going to have a task during this 60-minute session. What are we going to do? That's what is important, okay? And then planning it for the next session as well. What are we going to do? The therapy teaches the client to identify, evaluate, and respond to their dysfunctional thoughts and beliefs. What is the core beliefs they have it? Okay, that's what it's going to teach about. The therapy uses a variety of techniques to change thinking, mood, and behavior. So there is a change system as well is important. What you have been doing it before, and there is a change now how to deal with it, the problems. The therapy reinforces adaptive, positive principle that promote progress. So you always have to revisit during the therapy. The therapist has to facilitate that. What did I do in the first session and the second one? Yeah, there is a change there. Are we going in the right direction or not? Are we moving forward or not? So that is what we have to revisit it very often to motivate the patient to participate and deal with their problems. Okay. And next is CBT for me? Okay. That you have to analyze that. You'll have to have a formal chat, informal or formal chat with therapist. Okay. Am I ready to commit myself? Would I be able to have 6 to 8 sessions for my mild anxiety? Can I do that during this COVID-19? I don't know what can I do. So can I commit myself? That's you will have to decide. If it is yes, go ahead with the CBT. Does it work for me? I think so. It does work for me. If you feel it, go for it. Am I motivated to do so? Yeah, I am motivated at the beginning to resolve it. And once you know that little technique, and then sometimes you will not have the consistency to go ahead with the full therapy to complete it. Okay, that is what the motivation. Am I motivated throughout the session to deal with my problems? Am I willing to do homework? That's important. Yes, I am. Then go ahead with the cognitive behavior therapy. Will CBT a good fit for me? If you feel that it is a good fit for me, yes, it is for me. Go ahead and do it. If you feel that no, it's not for me, but it's not, you are not suitable for it, that therapist and the client can decide it before starting the proposition. Okay. A concept of CBT, as I mentioned, thinking, feeling, doing. That is what acting. So the way you think only you will feel. The way you feel only you act on it. Okay. Sometimes it's in the common sense model. We don't really think and we just act on it. That is what is important. So thinking, feeling, acting is a vicious cycle which you will have to keep it in mind when you are dealing in the cognitive behavior therapy. These think, feel, and do is very important. That is what you have to put it in your mind, is that different from the other common sense model and this model. I will explain it in the next slide as well. The basic principle of cognitive model is there is a cognition comes in between. I think so. You can see it, all of you can see the slides. Common sense model is any situation, any problem, any event, you just react it. Immediately emotions are out there. Okay. But here in the cognitive model, what we do is the situation and we are putting into the cognition as well. Cognition. Okay. What do you think that what is cognition? Okay, cognition is a kind of, as you said, thinking, that is perceiving and recognizing your own feelings and conceiving it and reasoning it. Okay, that is what it is. It's about identification of knowledge, of understanding it and perceiving it. Okay, it is more about assimilation and integration of knowledge. That's what it's about cognition. Then what do you know about intelligence? What is the difference between cognition and intelligence? Okay, the intelligence is assimilation of knowledge as well as the ability to apply your knowledge into practice in a proactive and pro-efficiency. That is what the difference. That's what in cognition you have to use the emotional intelligence. Okay, that's the difference between cognition and intelligence. So that's what we are going to use it in cognitive behavior therapy. What is the central concept of CBT techniques? Okay, we do formulation. Okay, that is what is important here. How do we formulate it? It's A, B, C form. What is A? A is an activating event, that is antecedent. What triggers you? What was happened, the recent triggers? What is the COVID-19? That is the one of the trigger. And how are you going to respond to it? And what is the belief about COVID-19? Okay, what's your core belief about it? Some people will have kind of good informations they have. Some of them will have a misinterpretation. They don't interpret in a good and a sensible adaptive way. They do tend to misinterpret. Most of us tend to misinterpret when there is a problem or high level of stress is there. We do that. That is called as a core beliefs. And then the C is consequences. What are the consequences? Such as like emotions and behaviors during this lockdown, when I have this COVID or when I have this cold or symptoms, how my emotions are, how are my behaviors. But if you think it in CBT way, it will be totally different, okay, compared to common sense model. And then how are I, as a therapist, going to do the formulation? Okay, what is the event? Whether it is any kind of situation, psychosocial stressors, or anything like that. That's what A. A is an event or situation. The world, okay, comes under that situation as well, because it's such a society. We live in it as well. Other people as well, that is in the relationship and the families, everyone, and personal experience, what we experience as well, and what are the personal histories. Am I an anxious person, or do my family have any biological history, or any kind of mental illness, or any kind of anxiety or depression? That as well comes under this as well. And thinking about the future and the self, about yourself, what you have it. Okay? And that's what comes under the activating event. And the B is the belief, what we have it, what I have to believe, what are the thoughts I have it, what's the thinking, what's my attitude, am I have a good attitude, no, am I a negative attitude all the time, and do I have the rules, what do you mean rules, am I perfectionistic? Yeah, some people will think that I can do everything, I'm 100% perfect. Nobody's perfect in this world, so we have to think that rules as well. And demanding, some people will think that, yeah, I need to have it. That's kind of stubborn things that as well interfere with your emotions and behaviors. And the belief, what is your core belief? Each and every individual have different beliefs. Okay, every one of us have different perception about COVID-19. And the image is what we have it, and what is the personal meanings I have it. But for COVID-19, every one of us have a different personal meanings of any situations. And then the emotions. C is the emotion. That's what we do deal a lot in CBT. And then we are trying to modify into adaptive behavior. Okay, you will have healthy feelings. Okay, it's good to have an anxiety. Yeah, I am anxious. Yeah, of course, before I have this lecture, I was anxious as well. No one say I didn't have an anxiety. Yeah, I would, but it's normal. I can cope with it. I can deal with it. Okay. If it is unhealthy feelings, that's what you will not be able to cope with it. That's what you have to get the education from the CBT. And then physical sensation. Whenever you have a psychological feelings, you will have that physical sensation, something in the tummy. I feel that I'm nauseated, that sensations are physical. You'll have to really realize that there is a psychological emotion and also physical sensation is you are going to experience. Okay, that you have to acknowledge that. And then based on those emotions, you're going to react it, you're going to behave it in a, some people will have a constructive action, some of them have destructive action. Oh my God, I can't really do anything. I have to run away from this problem. That's what's your destructive action. But even if you're running away from it, not dealing with the problem, it's going to come back to you anyway. Okay. Other day exploded in a big way, it will come out. Okay? And this is the formulation we do in CBT. The next is characteristics of CBT. It emphasizes the role of personal meaning. Personal meaning is very important. What's your belief? Okay, that is what it comes in the CBT a lot as well. And the CBT is more about collaborative and active participation of who has the problem. If the client has the problem, their active participation. That is the important thing. As a therapist, I do actively ask the client to participate and put their thoughts into it, what is it important. Okay? And then it is structured and time limited and very brief. Okay, if it is 6, it's going to be 6 because we are not going to have more than 6. Instead of 6, I can have 8. Yeah, we can have a chat. No, it's not. It's a brief because it's a goal oriented as well. It's a task oriented. You finished it. If we go beyond the therapy, what will happen is the client will be dependent on you. They will cling on you for everything. So I don't want to create any dependency there. You have to have the confidence to deal with it, what you have learned from the CBT. Okay, it is empirical and also problem oriented. That is what is important. It's from the experience. What is empirical is from the experience. It's not just a theory alone. Okay, it's more than the theory. What you have a lived experience from the client. That is what is important. What is your experience? That's what is called as a personal meaning. My experience wouldn't be the same experience like all the attendees. Okay, that's what there is a difference, that personal meanings. That's what we give more importance, that the personal meaning will come into an action, that what I am going to do with that problem. And it employs the techniques of guided discovery. Okay, we are there. I'm giving the guidance. I'm holding as the client's hand to discover that what I can do to deal with this problem by modifying your behavior. How are they going to modify their behavior? The therapist is going to teach certain techniques like mindfulness, compassion, and relaxation, all other educative stuff to cope with the situation. That's what it's called as a behavioral methods, and maximizes self-help techniques. Okay, I am going to own this. So if that's what I am going to deal with my problem, what suits me better, what I cannot do, what the client cannot do, I cannot educate them. Okay, it's not going to work in that way. Okay, it is a process and it will take time for them to learn and to seek help and get help as well. Okay, that's what. And understanding CBT, you feel the way you think. That's what I said. We do feel very quickly without even thinking. Okay, you have to now pay attention about your thinking. That's what it's about. You feel the way you think is very, very important thing. Okay, that link you have to get it before you are acting on it. You have to see, why am I feeling like this? Oh yeah, my thinking, what I think is, I think negatively. That's what I feel, very fidgety and nervous. Okay, that connection you will have to bring it in. Spotting errors in your thinking, which is when you have any problem, everyone will have that unhelpful thinking style will come up, that. Okay, so that is what it's. Spot your errors. What did I do wrong in it? Okay, spot that unhelpful thinking, spot it on, and then correct it. That is what we are going to do in CBT. Okay, the automatic negative thoughts comes in there, so how are we going to correct it? Okay, and tackling toxic thoughts. What is it? It's a toxic thoughts. It's our emotion, destructive emotions, and also our own negative automatic thoughts. That is what you're going to tackle with it. How can I change it into helpful behavior? Okay, and then designing and conducting behavioral experiment. Here, what are we doing exactly? Is describing the problem and formulation. That's what we are doing. A, B, C formulation. What is the situation and what is the core belief I have it, and what is the consequences I'm going to face it. How can I get into the healthy habit to have a balanced thoughts? Okay, and then paying attention. Okay, by paying attention, you're refocusing and also retraining. Okay, retraining your self-awareness. Okay, here is the very important thing is you're overcoming with your emotional problems by the education from the therapist. You are having a graded exposure and you are discovering yourself that how can I improve myself. Okay, that's what is the full understanding of CBT. How this CBT works, you have to do a lot. Okay, learning by doing. As Aristotle told that for the things we have to learn before we can do, we learn by doing. So learning by doing is very important. Okay, cognitive and behavior strategies. Okay, What is cognitive strategies? Cognitive strategies, as I mentioned that, thinking, feeling, and doing. That is what we are going to identify it, that link, okay? And then from that, if my thoughts are automatic, negative thoughts, that is the way we have been years and years. I've been negative, okay? So how are you going to have a balance now, making it to be positive thoughts, okay? That is you're going to learn through the behavioral strategies, okay, like mindfulness, compassion, and through the education and getting to know more knowledge about that and then putting into practice, okay. So behavioral activation, I think so I've mentioned a couple of times about that, having a balanced activities in day-to-day life, like necessary activities, pleasurable and routine activities, mixing all these together. So you have to do a lot, okay? The more you do, you will feel better, okay? Sitting at home watching telly is not going to make you better during COVID-19, okay? That's what, as I said, that three mixed activities is very important, is necessary, pleasurable, and routine, okay? That's what it's called as a behavioral activation. Psychoeducation, educating about the illness along with the medication as well, if it is necessary for the medication. If someone has have a severe illness, you need to have education about what is going on with me. It's very important to know that you are the best person to tell what's going on with you. So educating about that as well through this cognitive and behavior therapy. And then relapse prevention. How am I? If it has happened again or before it is happening again, how can I realize that relapse? How can I break down that, oh my God, I'm not feeling great now? Why? Because this has happened. This trigger has happened. There was a problem. That is what I'm feeling unwell. Okay? Getting to know that I'm getting unwell. That is what it's called as a relapse prevention. And then anxiety management, then graded exposure and stress and anger management and mindfulness and compassion. All these behavioral techniques is going to modify you. And self-actualization and developing assertiveness, learning assertiveness to cope with your illness. Okay? These are the strategies we do use it. I'm just going to explain to you as a cross-sectional, okay, just with a small example. There is a situation. The situation is COVID-19, okay? Your thoughts is, I'm so anxious, okay? You feel that there is a danger and threat. That is what it's about your thinking, okay? You feel that, oh, there is a threat or danger, something is going to happen, okay? How do you connect with this emotions, bodily sensation, and the behavior? The emotions psychologically, how do you feel that? When you have the threat and danger, you feel anxious, and there is a kind of little bit sadness, okay? That is what it's emotions, okay? And then bodily, how do you feel? I feel that little bit fidgety, restless, I don't know what to do, like all those kind of feelings, something in the tummy, some heaviness, I feel it. That's what it's about, bodily sensation. And the behavior is you're pacing up and down, doing restless. Okay, that's what is behavior. Okay, the bodily sensation, sometimes you feel sweaty and all those kind of things. Okay, this is the way you have to differentiate that your thoughts and beliefs, and then how do you behave and how do you show your feelings and emotions physically and psychologically. That's what you'll have to, in a simple way, you can divide it in these kind of little boxes, and then you can realize that, oh, why do I feel sweaty? I'm not feeling great. I'm perspiring a lot. Why is that? Oh, am I anxious? Yeah, that's what you're going to get it from it. Okay, it's a kind of cycle. You'll have to go through that. This is what we mostly use it for CBT. And then just to take home today, like 10 healthy attitudes for living. Okay, assuming emotional responsibility. That's very important. You have to have an emotional responsibility and personal responsibility to take up that any kind of situation. That's you assume that you have a responsibility. That's very important. And thinking flexibly. Think flexible. Okay. Don't be rigid. The rigidity is not going to helpful to you. Okay. You shouldn't think that the life should go in a straight line like this. Okay. It's not going to happen. Always ups and downs and pitfalls will be there. So be flexible in your thinking. It's okay to have a negative thinking, but then you can say that when you're sad, it's very common. Every one of us have to get the negative thinking. That's all right. Okay. Think it in it and then have a balanced positive thinking. What can I do? So that's what thinking flexibly is very important. And value your own individuality. Okay. That's very important. How are you? You value that I am an individual. I cannot be like others. You cannot be like me. Kopandevi cannot be like Poonam, Kopandevi cannot be like Kaman or any other attendees. Okay, you cannot be like that. So have your own individuality and value that, and you have your own distinct ability. Maybe it's totally idiosyncrasy to other people, but that's okay. That's okay. You have respect the others and they explain that your distinctive view. Okay, idiosyncrasies to others as well. That's what it's called as valuing and respecting others as well, and you're well adjusted. Okay, and accepting that life can be unfair. Yeah, definitely. You cannot be all the time expecting the life will be unfair all the time. Definitely bad things will happen to the nice people as well. It does, but doesn't mean that you are totally misfortune. Oh my God, why it's happening? No, it's always pitfalls is there. So accept that reality, what's going on. Understanding that approval from others isn't necessary. Okay, it's not at all. Okay, all the time. You don't need an approval from others. Okay, for example, like you're working there, your boss is saying that, oh, yeah, you did a good job on pricing. That's okay because at work, and he has to say that, but don't expect that from every people you meet. Okay, that is what. Don't expect approval from people. Whatever you feel it, just do that, understand that. And realizing love's desirable, not essential. Okay. In any relationship, basic lovability is relatively constant. Okay. You just see that any relationship with any difficulties, yeah, you need that love desirable. Even if it is unhealthy relationship, sometimes they want to cling on that they are dependent. They do that, but it is not essential if you have any problems. Okay. I hope you understand that. Yeah. And tolerating short-term discomfort. Yeah, tolerate that. There is a discomfort. If you tolerate that short-term discomfort, you can delay the gratification as well. Okay, so that way you can tolerate the discomfort, and also you will have that crucial part of reducing painful feelings of any major illness or anything. Okay, and then enacting enlightened self-interest. Have your own self-interest. That's very important. Having said that, like self-care, and that's what it's very important. And your own needs and interest, putting yourself into the first. Okay, if you are able, only you can help for others and for your family. So put yourself as a first and having a self-interest. That's very, very important. Okay. And then pursuing interest and acting consistently with your values. That's what, when you have an interest, when you have an hobbies, and have that as persistently, not just watching television is going to take it as a hobby. No, more productive and having involving in the community, doing some charity works, and that way you can show your interests and your hobbies and everything, and you felt that you are valued. Okay, and being consistent is very important as well. Tolerating uncertainty, that's very important. How are we tolerating any distress or any event or situation. Okay, there will be definitely life has an uncertainty. You will have to take a risk. Yeah, life has risk. Ready to face some degree of risk. Risk is inherent to existence. That's, you'll have to understand that. So take a risk. Okay, when you're taking a risk, and you learn a lot of life skills to cope with it. Okay, that is what you'll have to improve your coping strategies. Okay, deal with uncertainty things. All right, I hope that will be helpful for you to take home today. Thank you so much for listening patiently. You can ask now any questions or anything as well. Thank you very much. Thanks a million.
It is a wonderful session, Kokulan Devi, really, and there are, I think, very few questions.
Yeah.
Just they want to know how CBT differ from REBT,
Rational,
REBT therapy.
yeah,
Rational, yeah, yeah.
emotional therapy.
Behavioral
Yeah.
therapy, yeah.
Yeah, yeah. The CBT is completely kind of general, like kind of mental illness, and that is more, REBT is more about emotional based. Okay, we face about all the emotions is totally different. I'm not using that lot because I'm not trained in it. There are quite a few people. It's for one of the DBT skills. It's dialectic behavioral therapy for personality disorders. It's more for personality disorders, and I'm not expert in it in personality disorders, and I don't really do much about personality disorder because I'm not trained in dialectic behavioral therapy. It's more about the emotions with rational in it. It's a, one of the dialectic behavior therapy. I hope so. It will be helpful, the answer.
Yeah, yeah.
Yeah. Any other?
One more question we are having in the chat box. Like
Yeah.
people are want to ask, like people who are suffering from bipolar disorders or post-traumatic stress disorder, depression, sometimes they are indulged in the malpractices and like sexual practices to anguish their mental anguish. So does this alleviate their emotional pain or exacerbate them? We want to ask, like, about the people who are doing these maladaptive sexual activity. It is okay or it is helpful
Hold on.
to decrease their emotional pain?
Oh, okay. I cannot I cannot hear you clearly, but I can
Even
hear
I
that
could not.
for
Yes,
bipolar disorders, kind of how it's going to be helpful for their libido. That,
Yes, ma'am.
yeah, yeah, it is the libido is loss of libido is one of the problem of bipolar, especially in the depression. Okay, and so here we'll more about CBT, talk about educating themselves that what is bipolar and whether it is the bipolar, it's a unipolar with the depression alone, or it is something to do with sexual inhibition as well. And we'll have to give them more education about what is their illness, what they go through that. Okay, and then based on it, we can do sexual counseling along with the family, with the spouse. That's the best way of we do it. Okay, it's more about as a CBT therapist, I do kind of lot of education about what is bipolar illness and how it's going to affect them emotionally, physically, psychologically as well. Okay,
Okay,
that
ma'am.
I think so.
Yeah, ma'am.
Yeah. And is there anything else like?
Anybody want to ask any further query? Please write down in the chat box.
Oh yeah,
Um,
somebody. Yeah, go on, Tama. Yeah.
yeah. So there is another question I would like to ask. Like in schizophrenic patients, can we use this CBT therapy?
Yeah, 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 for psychosis. For psychosis, when they are psychotic, and we can use it as well. Yeah, We can use it, but we'll have to assess them. Are they suitable? Are they ready to perceive certain things in their mind? So we have to have a mental status assessment. If someone is acute, okay, unable to have a talking therapy, it's not possible, but we can assess them, their stress level and everything. If they are ready, they are able to understand, their thoughts are really coherent, then we can. Yeah, they can. Yeah, it's more like for CBT for psychosis is emerging a lot now. They do a lot now. Yeah, it does. Especially with the medication, adjunctive to the medication, we can do the CBT. It's going to be work for at least onset of the illness. After the onset of illness, 4 to 6 weeks later, then you can start that CBT for them. It will be helpful. Yeah, it is. And
One more question, ma'am.
yeah.
Sometimes, already you have mentioned about there's so many therapeutic interventions for dealing with the psychological problems. But nowadays, many people they are facing the toxic thoughts, or they are not able to balance their thoughts. Means, like you have said, rightly said about the model, cognitive behavior therapy model. So, how we can control our toxic thoughts or balance our thoughts in order to be remaining healthy in this crucial
Yeah.
time?
Yeah, that's the part is very important, that toxic thoughts, to bringing that how the toxic thoughts is unhelpful to your behavior and feelings. Okay, explaining that, and then modifying those thoughts into balance, into positive, by using the behavior strategies like reflecting it through your self-awareness, that is that automatic thought negative one, is it helpful to you? Give the evidence that, okay, negative thoughts, okay, I'm feeling anxious, what way it is impacts on your life? Okay, because it's negative, it impacts on it. How can you change? But it is automatic, it's very hard to change it. How will you change it? Through your behavior and modifying it in a simple small techniques. Like if you say that I'm always a failure, that's the thought, I'm always a failure. Why do you think that? You had a good prize from your boss that you did this project very well. So that's the positivity. So you can say that the evidence is, I have done it. Then why do you feel that I'm a failure? I'm not good in it. I'm not good enough in it. That's the automatic negative thoughts. So you'll have to bring it into positive. No, I'm not. There is no evidence in it. I am doing. There is an achievement there. There is a grade there. I have done it. So bring back that self-confidence there. So they are feeling low self-esteem. So this is what this is. The more you dwell into this negative thoughts, it will be into it all the time. It will be there. But that's the way I have been. That's the way Koparande we have been. So now I love to tell, oh yeah, bring it into positive. Have a balanced thought and see how it is. And then you can try your best to change that automatic negative thought into positive. That's the way you are bringing into reality with the evidence what you do it.
Ma'am,
Yeah.
as a participant, they are asking, would you please tell us the specific indication for the CBT or any good self-care books which we can read out for self-care management?
Oh yeah, for self-care books, yeah, there is a lots of books are there, which I am using it is mindfulness with compassion. Okay, that is very, very, very good for anybody's, for any people, whether you have a mental illness or not. It's very good to have a mindful. It's compassion. Compassion is more about being kind. Being kindness. Okay, that's what it's about. Being kind to yourself. If you are not kind to yourself, you cannot be kind to others. So that's what mindfulness is, really kind of changing your behavior. So that's what mindfulness, compassion with any books. I don't really use it particularly, but what I use it for cognitive behavior therapy is, this is the book. I'll show it to you because I really love this book as well. It's cognitive behavior therapy for dummies. Okay, it's a brilliant one, and it's been because when I did my course, that's what I got it. It's by Rihanna Branch, Rob Wilson. I'm so sorry. I meant to write the references. I didn't. I thought I did it. Yeah, this is very helpful. I can share it as well to Tamil Chelvi or Poonam as well. I can do that. Okay, if you want anything particular, you can always contact your principal so I can give that, which is the good books which you can read as well. And there is another one Indian girl. She wrote it. It's really very good about mindfulness and stuff like that. Her name is Sri Manju Katrakada, and she was in Ireland as well. Now she's in America. She's a software engineer, but she did this book as well. I can share it with you. You can get it. Connect to your inner guide. It's brilliant. It's really very simple, and you can learn that for anybody's, and that as well is very good. And we have an Irish man, Tony Bates. Okay, going through the depression. I think am I right? Something about depression. He did it. It's an excellent book. He's a psychologist as well. Okay, and he went through the illness and then he wrote it brilliantly. Going through the depression. It's Tony Bates. It's an Irish author. It's brilliant books. If you want, I can share it some books as well, references to your principal, and then you can get it from her. I can see a few more questions as well, like you have told CBT is initially emphasizes the present. Can you explain this? Yeah, it is more about the problem solving. That's what I mentioned about present. It is the problem solving. It's not focusing about the future, but it really gives the coping strategies to deal with your future problems as well. What? Present problem. It's the formulation and the problems at present, what I have it, you're going to focus it. And there is a few other as well. You have told CBT, okay. Could you please again behavioral activation techniques through an example? I did give an example like activities, day-to-day activities. It is day-to-day activities like necessary activities, pleasurable activities, and routine activity. Routine, all physical hygiene and everything, all routine, going to work and all those things. And pleasurable, what you enjoy doing it, your hobbies and interests. That's what it's about, pleasurable. Okay. And necessary, all necessary activities I have to do on daily basis, very important thing, like cleaning, cooking, all these kind of things. Okay. That's what it's about, behavioral activation. We say it in that language in CBT. And how one can bring back their own positive thoughts when a person is dealing with so many negative situations and dealing it alone. What's your suggestion? It's not alone because the therapist is there to hold your hand and to facilitate it, to bring it into positive thoughts. Okay, that's what it's about. Okay, the therapy is going to help it. Okay. And ma'am, what are your favorite psychologists for all times? I don't have any favorite or anything like that because there is nothing here to do with it. It's as a therapist, I'm really facilitating for the client to learn a lot from what I know from the expert. There is no favorites or there is no set things to follow. Okay, that's what I would say. Okay, would you please tell the specific indication for CBT? Indication for CBT, anxiety and obsessive thoughts and psychosis. You can do it. All right. And there is a CBT sessions for alcohol addictions as well. Okay. And how does one access suitability of a client for CBT? You will have to have a chat with the patient. Okay. Are there thoughts or disorder or not? Okay. Your thinking pattern is altered. You are not suitable for CBT. Okay. You have to have a kind of normal cohesive thought process. Okay. It's a mental process should be cohesive to go ahead. then you can have the CBT as well. And then the patient should have the interest. The client should have the interest to do it, and that's what. I think, ma'am, can you explain about catastrophizing and decatastrophizing? Catastrophizing is the extreme negative way, like they perceive everything as a threat. Okay, that's what it's the depression and anxiety comes in. They think that completely mental block, everything is, any problem is big for me. Okay, that is what they mind read themselves that everything is going to be wrong. That is called as catastrophizing. And how to bring it back, that catastrophizing into positive, that's what we'll have to have a therapy and few sessions to learn it, to have an optimistic way of thinking. Can we self-assess ourselves for CBT? Self-assessment you cannot do, but you can go with a therapist and have an informal chat and ask that, explore it, both of you. That's what I told about collaboration and active participation. Talk and had a sessions, am I suitable for it to do that? Okay, so is there any other questions, Tamil?
I think that's all. Questions?
Yeah, I think one more, Tamil. There is
Okay.
one, I don't know if somebody is asking, I don't know what's their name, I couldn't see. Ma'am, as a layman, I like myself. What is the difference between psychology and psychiatry? Which is the best? Which is the best for mental illness? Okay. So psychology is something you are dealing, it is about the therapy having it. Okay. It's more about, okay. It's an assessment. You can use it. Psychiatry is mental illness, dealing everything in it. Okay, psychological issues and the severe mental illness is psychiatry. Okay, that is what I just wanted.
Thank you, ma'am. Thank you, ma'am.
Yeah.
Okay.
Yeah.
Now
Yeah.
I think time is also going up. So
Yeah.
I would like my colleague Navina sir, please
Yes,
kindly
madam.
give a vote of thanks.
Yes,
Sir.
madam. Yes, thank you, Poona madam. Today we had a great session on cognitive behavioral therapy dealing with psychological problems. So, I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first of all start by giving glory to all the Almighty God for making today's occasion a resounding success. First and foremost, I thank our special guest, Ms. Kopparandevi Guruswamy, clinical nurse specialist, psychiatry of Old Age, Dublin, North City, Mental Health and Services, Ireland, for giving a wonderful session in detail about cognitive behavioral therapy, what is cognitive behavioral therapy, whether it is suitable for me, and what are the techniques of giving a cognitive behavioral therapy, what is A, B, C, and how to formulate it, and what are the characteristics of CBT, how to understand the CBT, and how cognitive and behavioral strategies are need to be implemented, and what are the 10 healthy attitudes of living. All these things we have learnt it, and I thank you so much, madam, for giving the valuable speech and webinar class in the moment. This is the need of the hour. Everybody is locked in the home, and everybody started their psychological issues, psychiatric issues. We are all seeing nearby areas. So continuously for a period of 2 months, nobody can sit inside the class, inside the home without doing anything. So lot crores of people are suffering from this one, and it is one of the very good learning session for all the nursing specialists and also psychiatrists and other people who are attended this webinar. Next, we are grateful to our honorable principal, Dr. A. Tamil Selvi, madam, for our opening remarks and giving this webinar to learn for all the students and also faculty of Amity College of Nursing. Thank you so much, ma'am. Then I will extend my wishes congratulations for Dr. Poonam Sharma madam for organizing this event with a wonderful session. I can say for all the students and for all the faculty who are attended this one. Thank you so much, madam. I would like extend my sincere thanks to Amity University and also the webinar team for this, Mr. Sudhanshu sir and also Mr. Rajkumar sir for giving the technical support, Amity College of Nursing, and all our faculty who are advertised this one to attend this one for all the students. And I extend my sincere thanks to all BSc Nursing, MSc Nursing, Post BSc Nursing students, and also PhD Nursing students of Amity College of Nursing who have attended. Today we have seen nearly 200 participants attendance. It's one of the great number for this session, and I thank all the students and also people who have attended apart from Amity College of Nursing, people from other nursing institutions and clinical areas also attended. I would like to thank each and everyone for giving your valuable support and attention for this webinar. I wish you a good luck. Thank you so much, everyone. Thank you.